have a situation in mind that you wanted to target today?
Yeah, I've noticed that I can be like, I don't like how I react sometimes when my kids are like upset or crying in the morning about like having to go to school or something like that. I feel like I generally handle it okay, but sometimes it feels like I'm like really trying harder than what I feel like I should be to stay calm.
Okay. And like usual, stop means stop. Anytime. Sure. You're totally in charge of your disclosure. That's right. Great. Your stop sign.
Remember that from our last session.
Awesome. Thank you so much. And so in terms of the memory that you just, or the situation you just described, is there a particular picture in mind that describes what you're thinking about?
Yeah. So like since my kindergartner started kindergarten, every morning he comes in and he's okay, and then when it's time to go to school, like time to like, okay, let's pack up, let's get shoes on, let's get out the door, he is like, I don't want to go to school, and starts like crying. And I know like I have to be patient and help him through that, but there's still this other part of me inside somewhere that like gets either like nervous about it, and then it kind of comes out as anger. That's like usually how my system works, so I'm thinking it's something like that. But there is like some level of frustration there that he's crying.
Yeah. When that happens, what does it make you think about yourself?
It's really strange. Like I as it's happening, I know like stay calm, this is fine, you're gonna pick him up, you're gonna help him through this. Yeah. But I still think it makes me believe like there's a part of me that I can't control.
Okay. And what would you prefer to think about yourself in that situation?
That I can stay calm.
And when you think about this happening for you and say the words, I can stay calm, on a scale of 1 to 7, 1 being completely false, 7 being completely true, where do you think you are?
Gosh, this is a tough one because I want to say 7, but there's also a part of me that knows, I do believe that I can stay calm, but there's a battle inside. There's like a battle going on. So like I really do believe I can stay calm, but there's still this battle.
Yeah.
Maybe I can stay calm isn't the right word.
Okay, yeah, what feels like a better fit for you?
That I think it's just that I can stay in control.
Okay.
Because sometimes it feels like I might not be able to control it.
Got it. And for that same scale, 1 to 7, 1 completely false, 7 completely true. Where do you think you fall?
4.
And when you concentrate on that picture that you painted for me earlier, that incident, and say the words, I'm not in control, what feeling does that bring up for you?
Sadness. Because thinking about like getting mad at my kid because they're having trouble adjusting to kindergarten makes me feel really sad.
Yeah. Anything else?
No, that's definitely the one.
Okay.
Yeah.
And on a scale of now 0 to 10, 0, no bad feeling, 10, worst possible feeling.
Yeah.
Where do you think you are on that scale?
For the sadness?
Yeah.
Like a 7.
Okay. Where do you notice that in your body?
Like my eyes, like my chest.
What's that like?
Like it feels like tears that will never come out, and like disappointment in myself.
Okay, so I'm going to ask you to hold together in your mind the image that you described to me, that feeling of sadness and disappointment in yourself, the feeling behind your eyes, that pressure, and I'm just going to have you follow, and we're going to check in at the end of the eye movements and see what comes up.
All right.
Sometimes it'll change, sometimes it won't. Just let me know what comes up, all right? And just follow. Let it go. Deep breath. What'd you get?
Like, nothing, like I don't have any animosity or anything like, towards my kid. It really like comes inward, where I feel like bad, that I even have a part of me that gets that feels angry towards when he gets upset.
Yeah. Okay. Go with that.
Okay.
Let it go. Deep breath. Okay,
Just kind of like watching it happen from like a third person perspective.
what are you noticing?
That I really hope my kid doesn't see that there's this part of me that's actually getting angry with them. Because I really don't want to be angry with them. I don't want to feel that way. Like I want to be supportive and I want to do, and I think I am, but it also still feels like it's difficult sometimes to do that. Yeah. Just kind of more sadness.
Still feel that in your body some places?
Yeah.
And your eyes?
Yeah.
Yeah.
Mhm.
Notice that?
Yes, I do.
And just go with that.
Okay.
Let go. Deep breath. What'd you get?
But not a lot. Kind of more of just like following, kind of the same path.
Okay. Where are you now on that 0 to 10?
Like once I saw it from third person, I realized I don't think my kid sees that part of me, and that really like took the distress down a lot. Where it's like it almost feels like it went, that particular feeling went to a 0, because it's like as long as I'm not doing damage, then a lot of that sadness like really dissolves away.
Okay. All right, and I'm going to ask you to get back that initial image. So the initial picture that you described to me, that's from the morning brush. And I'm going to ask you, what do you get now?
Whether or not I'm seeing this accurately.
Ah, okay.
Like maybe my kid does pick up on that.
Okay.
Or maybe there are times that he doesn't pick up on it and other times that he does. Like maybe I'm not being a good judge of it.
Okay. And so that's what you're saying to yourself now?
Mm-hmm.
Okay.
Yeah.
Go with that.
Okay.
Good. Let it go. Deep breath. Okay.
Yeah, I feel like I'm kind of stuck in this, like, what's reality and what's not? Like, is it true that he can't see it? Is it true that he can see it? Maybe he can't sometimes, maybe he can't other times.
Yeah.
Yeah.
And if there was something or someone that you think you could bring into the room to help you right now, something that would help you face this memory, maybe make some sense of that confusion that you're feeling,
Yeah.
what comes to mind?
My wife. I think if she saw me getting frustrated, she would just kind of gently step in and pick Ashton up, and that would kind of be like she would just gently step in and see that I was getting frustrated, and I could talk to her about it later, and I think she'd be really reassuring, and like she wouldn't judge me for getting mad. So I could like genuinely talk to her about it. And I think she might remind me of some of the things that we've talked about before, like repair work. Like you can always go back and just say, hey, like I was getting frustrated, but not at you. It was just getting frustrated because I didn't want you to feel upset. Like I think that's what it comes to, is like I don't want my kid to feel upset going to school.
Yeah.
So I get like angry within, like am I doing something? Am I not giving him enough attention beforehand? So I go into this like self-critical mode, which leads to like sadness, which then comes out as, well, maybe it displays as anger within, and then I battle the anger and like white knuckle it so that I'm not showing it on the outside.
That, and reaffirm your sense of humanity, and this is an understandable reaction. It doesn't define you.
Yeah, I think she would. And also I think she would remind me that she's not always there for that like time. Like she's usually left, so I'm gone to work, so I'm usually there.
Yeah.
But like I remember myself like just the other day that happening, and I just picked him up and carried him downstairs, and was just like, I know it's really tough to not want to go to school, even though like you have to go to school. So like I would just kind of like recognize his situation and share compassion in that way. And then as soon as we walk out the door, he's fine.
Sure.
So it's not like I see things that let me believe he's like holding on to this really strongly. Like he walks out the door, then he's fine and wants to go see his friends and get on the bus. Like once the bus comes, he's never like, I don't want to get on the bus. It's just like getting out the house. Yeah.
Yeah. Go with that.
Okay. I think I'm getting a lot of things like from my childhood, but I'm wondering if it's okay to like go back in time, because this feels like a different subject, but they're like totally linked.
Well, it seems like maybe you can tell me a little bit more about what you're thinking about and see if it's something you think we can target.
Okay, so I remember like my brother kind of has like a time limit on his like ability to manage his emotions. So like he can go somewhere or be somewhere, and after a certain amount of time he's done, he's ready to go, his anxiety kicks in, and I get this like feel of like waiting for that moment to happen. And then I feel like when I see my kid upset, I get this feel that like everything's unraveling or coming apart. But for my brother, it did unravel and come apart, and for Ashton it really doesn't. Like he might get upset, but he's very consolable. Like you can pick him up and console him, and within a few minutes he's transitioned into a different emotion. But I feel like I get that same anxious response of like things are going to start unraveling.
Yeah, absolutely.
Yeah.
And where do you think the difference is between the experience with your brother and with your child?
Well, my brother has a developmental disability, so he doesn't have the ability to self-soothe and transition quickly. Where my son does not have a developmental disability, and he can transition emotions quickly. So there's a big difference in just them as people.
Okay.
Yeah.
And so is it the same thing you're saying to yourself in those situations?
I don't think it's the same thing I'm saying to myself, but I think that anxiety that like kicks in, it feels exactly like the timer's going off.
Yeah.
Like, and I get that feel.
Maybe that's something for a target that we can target instead of sort of the original memory. Does that feel okay?
Yeah, that feels okay. Yeah.
Let's go with that.
Yeah. So I've done a lot of work on that.
Yeah.
So like kind of going back to that, like I think I feel like a lot of that work is done, but the link wasn't severed.
Yeah.
So like, and maybe the fact that there still is a link means that there's more work to do, but just severing that link of like, these aren't the same situations, like really dissolves a lot of the stuff with my son.
Yeah. Okay. Go with that.
Okay. Yeah, it's weird, and I don't know if this is okay, but I like went right back to like my son.
Makes sense.
And it was like everything just kind of like reshifted.
Yeah.
And like all things with my son, it's like, oh yeah, like I can totally handle. There's no timer.
Yeah.
There's no like, because I'm seeing him have emotions, that like everything is just gonna fall apart.
Yeah.
Like that happened in my childhood because of what was the reality of my family, but that's not the reality of my family right now as an adult with my own kids.
Yeah.
So like it really like untangled a whole lot of stuff, just recognizing that like.
And what are you saying to yourself now?
That like of course I can stay in control. Like this is easy compared to what was then.
Yeah. Okay.
Yeah.
Go with that. How'd you get that done?
That like of course I can stay in control.
Yeah.
Yeah.
And where are you now on 0 to 10?
Definitely 0.
Getting back that original.
Like that just seems like so much. I think like the big thing was just the emotional, like what was happening inside me.
Mm-hmm.
I had nothing to do with my son. It was just like what was happening inside of me, and I was linking it to something else. Once that kind of gets like severed, it's like, oh, yeah, we're good.
Okay. And I can stay in control. How does that sound to you now? That same scale, 1 to 7. 1 completely false, 7 completely true.
Which one's true and false?
1 is completely false,
Right.
and 7 is completely true.
Yeah, 7.
Okay. Go with that. Let's say the words.
I can stay in control.
Awesome. Go with
Yeah.
that. Let go. Deep breath. Those words, I can stay in control. Original target in mind. More true, less true, or about the same?
About the same.
Okay.
Yeah.
Go with that.
Yeah.
Deep breath. I can stay in control. More true, less true, about the same.
The same. Yeah,
Okay.
I definitely believe that.
Okay.
Yeah.
So now I'm going to invite you to get that target back in mind, that
Okay.
original scene that you painted for me earlier.
Mhm.
Scan all throughout your body for any sensations, discomfort, tension. What do you notice?
It seems like the easiest piece of parenting to like do now. Like it's like of course I can like stay in control. Like there's no timer, there's nothing's gonna happen. He just needs the calmness that I can provide, and we'll move on.